Ms. Adib, if a woman comes to you and says, I have no energy, my memory is terrible, and I can't sleep, do you straight away think it could be the menopause?
So if it's a lady who's around about the age of 50, then certainly these symptoms could indicate the menopause. The menopause is an inevitable occurrence for women, and the average age in the UK for the menopause is 51. The experience of the menopause is different for each woman. Most commonly women would experience hot flushes and sweating at night, but there are a whole range of symptoms and lack of energy, poor sleep, poor memory, mood changes, loss of libido. These are all symptoms that can be experienced in the menopause, and each experience is different for each woman.
And do you feel that because you are a woman, your patients tend to open up more about those sometimes difficult subjects than if you were a male gynaecologist?
I don't know. I think a lot of women probably feel more comfortable with another woman, but I think it's really down to how well you get on with your gynaecologist, and I think that's a very personal and individual thing. And I think it's really important to find someone that you do feel comfortable talking to, whether that is a man or a woman.
And once you've established that good rapport, and okay, you suspect, yes, you might be entering the menopause, what sort of tests, where do you go from there?
So, diagnosis of the menopause really mainly is a clinical diagnosis, depending on what the woman's symptoms are. We don't normally do tests in someone who's 50. If someone who's much younger is experiencing symptoms of the menopause, so below the age of 45, we classify that as an early menopause. Below the age of 40, we classify that as a premature menopause. And in those circumstances, it's really important to get the right diagnosis. And in those circumstances, we would do blood tests to check the hormones to see if the woman's going through the menopause, so that we can advise correctly and offer hormone treatment. The most effective treatment of the menopause is hormone replacement therapy. It's not for everybody, but certainly for women who are going through an early menopause, the benefits of hormone treatment generally outweigh the disadvantages. So in someone who's going through a natural menopause, we would go on symptoms and offer hormone treatment.
And a woman who says, I don't want hormones, are there alternatives? Do you have other recommendations?
So there are lots of things that women can do for themselves, whether they take hormone replacement therapy or not. And those are looking very much at diet, maintaining a healthy weight. Exercise is really important for both heart health, mood and bone health. So these are things that really we should all be doing after.
Oh yes, we should.
After a certain age.
All right. Ms. Adib, thank you very much.